Hello everybody. This is the lecture on the spleen in our series on abdominal sonography. So we often use sonography in conjunction with other imaging modalities to follow up any pathological processes that affect the spleen. And I have some key terms here. So an accessory spleen is a small island of splenic tissue that is often located near the splenic hilum or near the tail of the pancreas, and we refer to this as a splenule or a splenuculus, or some may say it is a supernumerary spleen. An angiosarcoma is a rare malignant tumor of the spleen, and it is derived from blood vessels. A splenia is the congenital absence of the spleen. Autosplenectomy is a gradual fibrosis and dysfunction of the spleen secondary to disease. Bacterial endocarditis, infection of the surface of the heart that can spread to other organs. Beckwith-Wiedemann syndrome, it's a growth disorder synonymous with enlargement of several organs, including the skull, tongue, and liver. Blunt trauma is non-penetrating. Culling is the splenic process of removing irregular red blood cells from the bloodstream. The Epstein-Barr virus or infection is a herpes virus that can lead to the infection known as mononucleosis. Erythropoiesis is a process of making red blood cells. Extramedullary hematopoiesis is the spleen's hematopoietic function, and this can return in cases of severe anemia. Granulomas are small echogenic calcifications that result from inflammation of tissue. Granulomatous disease is inherited, and these are diseases that disrupt the normal immune system and cause it to malfunction, resulting in immunodeficiency, or chronic inflammation and granulomas in several organs. Hemangioma is a benign tumor composed of blood vessels. Heterotaxia syndromes are situations in which the organs of the chest and abdomen are abnormally arranged. Histoplasmosis is a disease that results from the inhalation of airborne fungus, and these fungus can affect the lungs and they spread to other organs. Hodgkin lymphoma is a carcinoma of the lymphocytes, and it has quite a high recovery rate. The hydatid cyst is a cyst that results from the parasitic infection of an organ by Onychococcus granulosum. Lysis, this is breakdown of the cellular membrane. Mononucleosis is an infectious disease caused by the Epstein-Barr virus. Non-Hodgkin lymphoma is a carcinoma of lymphocytes and a cancer of the lymphatic system. Pitting is a splenic process of cleaning red blood cells of unwanted material. Polysplenia is having many small islands of splenic tissue. Portal hypertension, this is the elevation of blood pressure within the portal venous system. A red pulp is specialized tissue within the spleen that performs a phagocytic function. Red Sternberg cells are cells that indicate the presence of Hodgkin lymphoma. Sarcoidosis is a systemic disease that results in the development of granulomas throughout the body. Sickle cell anemia is an inherited disease in which the body produces abnormally shaped red blood cells. A splenic cleft is a congenital anomaly in which the spleen is divided into two portions by a band of tissue. Splenic hamartomas are benign splenic masses that are often associated with Beckwith-Wiedemann syndrome, as well as tuberous sclerosis. Splenic infarcts, areas that have become necrotic due to a lack of oxygen on the spleen. Splenic lymphangiomas are benign tumors composed of lymph. Splenic torsion is a twisting of splenic vasculature. This is caused by a disruption in the blood supply to the spleen and subsequent ischemia. Splenomegaly is an enlargement of the spleen. Splenosis is the implantation of ectopic splenic tissue, possibly secondary to splenic rupture. A splenule is an accessory spleen. Tuberous sclerosis is a systemic disorder that leads to the development of tumors within various organs. A wandering spleen is a highly mobile spleen, and white pulp is specialized lymphatic tissue within the spleen. So we can look at anatomy of the spleen, and the spleen is the largest structure in the reticuloendothelial system. The spleen is intraperitoneal, and it is located within the left upper quadrant of the abdomen. The spleen's primary objective is to filter peripheral blood, and the gastrosplenic ligament attaches the spleen to the stomach. The spleen is placed inferior to the diaphragm and posterior lateral to the stomach. But once again, the gastrosplenic ligament attaches the spleen to the stomach. The spleen has a concave inferior surface and a convex superior surface, and we consider it the largest lymphatic organ of the body. The spleen begins development around the 5th week of gestation, and in the fetus it is responsible for erythropoiesis. In childhood, it plays an important role in defense against infection, whereas in adults, the spleen produces lymphocytes and monocytes. Now, although red blood cell in adults is primarily performed by bone marrow, the spleen still retains a hematopoietic function, and this can return in cases of severe anemia, and we refer to this as extramedullary hematopoiesis. So there are certain anatomical borders to the spleen. One being the stomach existing laterally. Inferiorly is the left kidney. Laterally on the other side is the adrenal gland and the pancreatic tail. So in this case, this is medial-laterally. You find the adrenal gland and the pancreatic tail, and superiorly we find the diaphragm. Functions of the spleen. The spleen acts as a defense against disease with its lymphocyte and monocyte production. It plays a role in hematopoiesis in fetuses, destruction and removal of flawed red blood cells and platelets. It is a blood reservoir, and the spleen stores iron. The spleen is composed of specialized tissues, and we call these specialized tissues white pulp and red pulp. The lymphatic function of the spleen is performed by white pulp, and these produce lymphocytes and monocytes, and it's primarily to aid in the immune response. Red pulp, on the other hand, contains red blood cells and macrophages, and this red pulp performs the phagocytic function of the spleen. So just to reiterate, I had said monocytes are created by white pulp, and that might be true, but I'll check and get back to you. So back to the red pulp. Phagocytes which are the macrophages produced by the red pulp, engulf and destroy pathogens. And the spleen also removes irregular blood cells from the bloodstream through the process called culling. The spleen can also clean red blood cells of unwanted material, and that's a process called pitting. Vascular anatomy of the spleen. So the splenic artery is a branch of the celiac trunk, and we may refer to the celiac trunk as the celiac artery or the celiac axis. Now, from the celiac trunk, the splenic artery courses laterally towards the spleen, and it marks the superior border of the pancreatic body and tail. And this is where the splenic artery can be confused for the main pancreatic duct in some patients. The splenic artery enters the spleen at the splenic hilum, and it enters the hilum superiorly and anteriorly to the splenic vein. Now, the splenic vein exits the spleen and travels along the posterior border of the pancreatic tail, and it joins with the superior mesenteric vein posterior to the pancreatic neck to form the portal vein. So, how do we find the spleen sonographically? So most often the spleen is visualized with deep inspiration, and our patient would be lying on their right side, so sort of like a lateral decubitus position. Sonographically, the normal spleen is isoechoic to the liver, although in certain cases it might be slightly more echogenic. The adult spleen has a concave, pointed inferior margin and a convex superior border, and this creates the typical crescent moon shape. The size of the spleen in adults varies, and the spleen decreases in size with advancing age and may enlarge when pathology is present. The splenic hilum, which is located along the medial surface of the spleen, is a location of splenic vessels. As we can see here, there's the abdominal aorta, there's the celiac trunk, where its lateral branches, one of the lateral branches is the splenic artery. Here's the portal vein, which is formed by a union of the superior mesenteric, inferior mesenteric, and the splenic vein. And here's a gastric impression. Note that superiorly, one of the anatomical structures we find to the spleen is the stomach. So there are certain congenital anomalies and variants that can exist in the spleen, and some people may have an accessory spleen, and we refer to this as a spleniole or supernumerary spleen. And this would present as a small round island of splenic tissue, and it is typically located near the splenic hilum, or in some cases near the tail of the pancreas. The accessory spleen will appear isoechoic to the normal spleen, and the spleen may also appear to be divided by a hypoechoic line in some individuals, and we refer to this hypoechoic line as the splenic cleft. Conversely, we can have asplenia and polysplenia, where asplenia is the absence of the spleen and polysplenia lead to the development of multiple small masses of splenic tissue. These are both associated with cardiac malformations termed heterotaxia syndromes. The implantation of ectopic splenic tissue is referred to as splenosis, and it can occur following splenic rupture. And in this situation, ectopic tissue can resemble a mass. Though this is quite rare, The spleen may be identified as a wandering spleen, in which case the splenic ligaments are absent or underdeveloped, and this allows the opportunity for the spleen to be quite mobile and often positioned well into the lower abdomen. And such patients, a wandering spleen can lead to splenic torsion due to the mobility of the spleen and the risk of the vessels twisting secondary to this organ's hypermobility. And the torsion can lead to splenic infarct. So here we have an accessory spleen. You can see an isoechoic mass adjacent to splenic tissue. And so here's the spleen, and we are looking at the splenic hilum, and we can see an accessory spleen. So pathology of the spleen, splenomegaly, and this is the most common abnormality. Enlargement of the spleen can be manually suspected on a physical exam, and we can confirm it using sonography. The spleen should never measure more than 12 to 13 centimeters in length and 6 centimeters in thickness in adults. Suspicion of splenomegaly should arise when the spleen extends beyond the inferior pole of the left kidney. As the spleen enlarges, it tends to become more hypoechoic, and one of the most common causes of splenomegaly is portal hypertension. And when portal hypertension is suspected, then the splenic hilum should be evaluated for evidence of abdominal varices. Other causes of splenomegaly include trauma, leukemia, pediatric sickle cell disease, Epstein-Barr infection, etc. Clinical findings include a palpable enlarged spleen, certain hemolytic abnormalities such as sickle cells, trauma, infection, histories of cirrhosis, and a possible elevated white blood cell count. Sonographic findings include enlargement of the spleen greater than 12 to 13 centimeters in length and thicker than 6 centimeters. When the spleen extends beyond the inferior port of the left kidney, we are suspicious for splenomegaly. And here we have an image. It's a transverse image of an enlarged spleen in a patient with cirrhosis and portal hypertension. Note there are multiple prominent blood vessels adjacent to the splenic hilum. There you are. Splenic cysts. Most often true splenic cysts will have thin walls, an anechoic center and posterior enhancement. Although cysts found in the spleen can appear complex, and they're complex when they're associated with trauma. Clinical findings might be asymptomatic, but pain can occur with hemorrhage. And sonographically, we see round, smooth-walled masses that are anechoic and demonstrate posterior enhancement. But this is not particularly seen in this image. Splenic abscesses. Though uncommon, an abscess can develop in the spleen. And clinical findings of a splenic abscess may include fever, leukocytosis, and left flank pain. Sonographically, splenic abscesses might be complex. They may contain debris or gas, or they can be completely hypoechoic. Splenic infarcts. Tissue that has been deprived of oxygen will eventually die, and this is referred to as an infarct. Infarct in the spleen can be caused by sickle cell disease, bacterial endocarditis, tumor embolization, vasculitis, and lymphoma. Clinical findings of a splenic infarct include sudden onset of left upper quadrant pain. Sonographic findings include, in cases of acute infarct, hypoechoic wedge-shaped masses within the spleen, and chronic infarcts are hyperechoic, wedge-shaped. So the difference between splenic infarcts is the echogenicity. If it is hypoechoic, it's most likely acute. If it's hyperechoic, it's most likely chronic. And a good example here is a splenic infarct, and it looks like a wedge-shaped hypoechoic mass. It's most likely this is an acute infarct. Splenic trauma. The spleen is often injured in cases of blunt trauma. And patients who suffer from splenic trauma complain of left upper quadrant pain and will have decreased hematocrit. A hematoma within the spleen can be quite difficult to identify, and it may appear isoechoic to splenic tissue, and it can be either subcapsular or intraparenchymal. The evolution of splenic hematomas as the blood undergoes lysis may change from complex to hypoechoic early in the event, to echogenic or isoechoic, and then back to hypoechoic or anechoic as the hematoma resolves. Occasionally, a laceration may be noted as an echogenic line within the spleen immediately following trauma. In time, hemorrhagic cysts might develop. So clinically, we're looking for blunt trauma to the left upper quadrant of the spleen, and we're searching for severe left upper quadrant pain and decreased hematocrit. Sonographically, we're looking for hypoechoic complex masses in the acute stage. We're looking for something that is echogenic with clot formation in the middle stage, and we're looking for something that is anechoic in the later stages. Chronic hematomas may have calcified walls. Splenic hemangiomas. The hemangioma is most often referred to as a common benign tumor of the spleen, and a splenic hemangioma will most often appear as a well-defined hypoechoic mass. Patients with hemangiomas will be asymptomatic, although pain may occur with hemorrhages. Clinically, they are associated with pain and asymptomatic. Sonographically, they're well-defined hypoechoic masses. As you can see here, we have a splenic hemangioma and the two small echogenic masses representing these hemangiomas. And these are noted in the asymptomatic patient. Granulomatous disease. Occasionally, small echogenic foci may be seen throughout the spleen. These small foci often represent granulomas. They can be individual or multiple, and granulomas can be found in patients who have a history of histoplasmosis, tuberculosis, or sarcoidosis. While granulomas tend to be small, large calcifications may result from the resolution of splenic hematomas, and clinically, granulomatous disease is seen in patients who have histories of histoplasmosis, tuberculosis, or sarcoidosis. Sonographically, we see small echogenic foci that may shadow. Splenic hamartomas. The splenic hamartoma is quite benign and typically appears as a hypoechoic mass, though the sonographic appearance can be variable. These tumors have been associated with Beckwith-Wiedemann syndrome and tuberous sclerosis. Clinically, patients might be asymptomatic, they can have pain, and they might have a history of Beckwith-Wiedemann syndrome. Sonographically, we see hypoechoic masses, and color Doppler may reveal hypervascularity. Malignant diseases of the spleen. Patients with splenic malignancy may suffer from left upper quadrant pain, fever, weight loss, and general malaise. Although quite rare, the primary malignant tumor of the spleen is an angiosarcoma, and these appear sonographically as complex or solid masses. More often than not, lymphomas and leukemia, rather than angiosarcomas, will involve the spleen, and the lymphoma is cited as the most common malignancy of the spleen. Diffuse involvement of the lymphoma can produce splenomegaly, and these malignant processes can manifest as a focal disease and will be recognized as hypoechoic masses. The presence of Reed-Sternberg cells would indicate a Hodgkin lymphoma, and this can be treated and carries quite a high recovery rate. The other form of lymphoma, non-Hodgkin lymphoma, might not be easily managed. Metastatic disease to the spleen is rare and occurs later in disease processes. Clinically, patients complain of left upper quadrant pain, fever, weight loss, and general malaise. Sonographically, the spleen would have diffuse involvement of malignant processes and will demonstrate splenomegaly. Sonographically, they might be focal hypoechoic masses. So on this image here, we see a lymphoma and a transverse image of the spleen in a patient with Hodgkin lymphoma. So Hodgkin lymphoma in this case was confirmed by the presence of Reed-Sternberg cells. And there it is between the calipers. Splenic lymphangiomas are benign lesions that are congenital malformations of the lymphatic system. Sonographically, lymphangiomas appear as multicystic masses that contain hypoechoic or anechoic locules. Patients often suffer from nausea, abdominal distension, and left upper quadrant pain. Sonographically, we see multicystic masses, and masses may contain hypoechoic or anechoic locules and hypoechoic septations. Pediatric pathology, sickle cell anemia. So sickle cell diseases are a group of inherited blood disorders that include sickle cell anemia. Those with sickle cell anemia have abnormally crescent-shaped red blood cells that have a tendency to attach to normal vascular channels and occlude blood vessels. It is more commonly found in people of West African descent, and in certain cases, or rather children who are suffering from sickle cell disease often have enlarged spleens. Note that the spleen can also become enlarged in cases of chronic malaria. The spleen in the case of sickle cell anemia will eventually become fibrotic and atrophy, and the wasting away of the spleen in this manner is caused by multiple infarctions, and we call this autosplenectomy. And patients undergoing a sickle cell crisis may have decreased hematocrit and may complain of bone pain, and these patients are at increased risk of multiple organ damage. blindness, gallstones, and strokes. Thank you.